T syndrome, pathology of rheumatoid arthritis. The invasion of external wind, cold, and dampness is the trigger for the development of RA. In this disease, especially wind and dampness, settle in the joints, making qi and blood stagnate and causing intense ache. Dampness obstructs the channels, joints, sinews, and muscles, and causes swelling, ache, numbness, and a feeling of heaviness of the limbs. Dampness frequently generates heat, and damp heat settles in the joints. This causes the redness of the joints and makes them feel hot to the touch. Please do not be surprised if a patient suffering from RA manifesting clearly with damp heat, red and hot joints, has a pale tongue. This simply shows that there is an underlying deficiency of kidney yang that has allowed latent heat to develop. In some cases, the acute invasion of damp heat causes acute symptoms of external invasion, such as acute onset fever and aversion to cold. This happens especially in children contracting juvenile arthritis. Although damp heat is a frequent manifestation in RA, it is not the only one. There are cases of RA when the predominant pathogenic factor is dampness without heat, in which case the joints are neither red nor hot to the touch. Moreover, there may even be cases of RA manifesting with dampness and cold in the joints, in which case the joints are pale and the skin over them is shiny. Please note that this would give rise to a complex situation in which there is dampness and cold in the joints but also latent heat. The chronic retention of damp heat may further complicate the pathological process, as the heat part of damp heat may injure yin and therefore contribute to the malnourishment of sinews and bones from yin deficiency of the liver and kidneys. If the patient had a pre-existing condition of kidney yang deficiency, there may then be complicated and conflicting manifestations of yin and yang deficiency. For example, the tongue may be red, but the patient feels cold all the time. With time, dampness may transform into phlegm. This obstructs the joints more and starts to cause destruction of the cartilage and bone deformities. Phlegm also aggravates the numbness of the limbs. On the other hand, the pre-existing deficiency of the liver and kidneys leads to malnourishment of the sinews and bones, and this is the underlying cause for the destruction of cartilage and the formation of bone deformities. In chronic cases, the qi stagnation in the joints may give rise to blood stasis, and at this stage, the pain in the joints becomes intense and it may be worse at night. Blood stasis also makes the joints rigid. The development of blood stasis is also caused by the presence of phlegm in the joints. As blood stasis and phlegm are both pathologies of the body fluids, they aggravate each other. In the case of RA, the obstruction by phlegm in the joints leads to blood stasis. The nodules that form on the joints in RA are due to the combination of phlegm and blood stasis in the joints. Thank you for your attention.